Hey everybody, Alan Weber here on a Friday from City Hall with my new Santa Fe mask on, very label and brand specific. Terrific, terrific safety. Always wear a mask when you go out. Wash your hands, practice physical distancing. We are trying to continue to bend the curve. We want Santa Fe County to get from red to yellow to green. And then after we get to green, we want to continue to go even better into our recovery. We'll talk about that another time. A couple of numbers before we talk to our guest, Dr. Wendy Johnson, who is always available to us for a Friday briefing on vaccinations, all things related to COVID and how we're making progress. We appreciate Dr. Johnson being with us. Thank you. Let me just read a couple of quick numbers. The last 4 days, new cases of COVID in Santa Fe County, 35, 32, 29, and 30. So we are, I remember when it was 0, 1, 2, and 3. We're not down there, but I also remember when it was 80, 90. We are making some progress. We are getting back down to a safer zone, but we can't lose focus. We cannot assume that just because vaccinations are moving forward, all bets are off and we can just lose focus. We've got to continue wearing masks, practicing physical distancing, and especially DOH says this Sunday, Super Bowl Sunday, don't make Super Bowl a super spreader. So watch it if you're a football fan with your family. Don't bring in a bunch of folks one of whom might be sick. And then all of a sudden the numbers go back up and we're not going from red to yellow to green. We're stuck in red. So with that said, also remember something I mentioned almost every time, constantly, there is an app called Novid, N-O-V-I-D. Novid app on your smartphone or device will help you know whether, it's like a radar screen for people who have tested positive. So please download Novid. And now let's talk to Dr. Johnson from La Familia, Chief Medical Officer. So headline news, Dr. Johnson, what is happening in Santa Fe County with vaccinations? How are we doing? It's obviously not yet a well-oiled machine, but I get the feeling that more vaccinations, more medicine is getting into people's arms.
Well, I think it's by its nature is kind of messy. So I'm not sure it's ever going to be the well-oiled machine that people really want, because it's impossible to balance all these different concerns. What we have to deal with, the people who are giving out the vaccines, the Department of Health, the hospitals, the health clinics, is looking at our patient population and determining who is basically more worthy, because we have way more demand than we have supply. So in that situation, we're forced with thinking about, okay, we've got the 85-year-old person with very healthy, or we've got the 74-year-old, abuelita who's like on oxygen and has diabetes. We have the 25-year-old that might have obesity and that's it. And technically all those people are in the group that are able to be vaccinated right now. Okay. But we know that, you were telling me before we went on, we know that 40% of our seniors across the state have been vaccinated. My guess, I'm not sure if we have Santa Fe County numbers on that, but my guess it's even much higher in Santa Fe, since we've already vaccinated 25% of our total population. And most of that has been either healthcare workers or over 75. We just started expanding to those folks with chronic disease that are under 75. So that's why I say on that list of chronic diseases, diabetes, cancer, heart disease, obesity, kidney disease, history of an organ transplant. So if you have any of those diseases and you're over 18 for the Moderna virus or over 16 for the Pfizer, you're technically in the group that is eligible to get a vaccine. Should you go get one? Should you try? How can you get one? We'll get to that a little bit later, so stay tuned. But it's really hard to weigh all those things. And then you have the essential workers. What's your exposure? So far, we're not in the place where we're vaccinating essential workers unless they have one of those other conditions. And then there's a question of our high-risk zip codes in Santa Fe. You know, we have one of the zip codes that's been amongst the highest risk in the state, and shouldn't that count? So there's so many things we're juggling and trying to take into consideration as we're giving out this very still very small supply of vaccine. I think it's going to get bigger. One thing I wanted to say about the Novid app, especially as we open up more, which hopefully we will do very soon, because looking at the one statistic you didn't mention was our test positivity rate. Okay, now to go from red to yellow, there's two ways we can do it. We can get our test positivity rate below 5, and right now it's just a smidge above 5. Okay, so I think in the next 2 weeks, we can probably get our test positivity rate below 5. And maybe by the end of February, I'm hopeful, we could go to yellow in Santa Fe. The other number is we have to get our average daily case number below, I think it's 12. So if, you know, that's probably a little bit farther off, I think, but we're just on the edge of below 5. So as we open to yellow and people decide, should I go to a restaurant or not? Like right now I have the Novid app, and it's really boring because I'm actually never really around people. Patients in the clinic occasionally, but I'm doing a lot of telehealth too. So it's not going to light up because I'm never around people. But as we reopen, it's going to be really important that people get that app. Because if you go to a restaurant and somebody at the next table happens to have light up positive the next day, you'll get a ping on your phone.
And let me just add a few thoughts about how to get that positivity rate our way. As of the emergency order that I put out last week, we will begin testing Santa Fe city employees. I'm confident most of them will test negative. We'll have more negative tests and more tests overall. And so that ratio will tilt in our favor. Now, we're going to make that something that works depending on whether you're working at home. It's different than if you're working in the field as an employee. But overall, we want to increase the number of tests. We want our folks to know if they're safe. We want to know if they're not safe. We want to give them the opportunity to have that information. But since we're looking at a ratio, the more tests overall, the better the chances are we'll have a better positivity rate. And you can get a free test from Vault Health. You can order it online. Just Google Vault Health. Tell them there's a simple form to fill out. You get a free test. Comes to your home. You have to do a Zoom call to fill up a vial with your saliva and mail it in. Very soon thereafter, you get a notice that you quite likely tested negative. And it's a very good way to help us go from red to yellow. And then we can reopen some things. And I think with the combination of more testing and more vaccinations, we'll begin to be closer and closer and closer to that famous light that's at the end of the tunnel. So you wanted to talk a little bit about different channels or different the vaccination pathways that are in front of people and myths and legends.
Yeah. So first of all, I just want to talk about La Familia a little bit because there's been some misinformation about La Familia out there. We are vaccinating our patients along the same guidelines that the Department of Health is vaccinating. So our top priority is anybody among our patients who is a healthcare worker, works in a congregate care setting, a nursing home, who hasn't yet been vaccinated, which is a very small number because we've done a really good job at vaccinating those people, certainly. And again, among our patients, established patients. The other category, of course, 75 and older, folks 75 and older. And we've called all our patients who are 75 and older once, twice, 3 times. We're sending them letters. So some of that population is difficult. They can't get on the app. So we're trying to get those people in. And then the third population, as I said, it's people under 75 with one of those chronic diseases, one or more. And actually, we're prioritizing in La Familia people who have multiple of those chronic diseases. So when I was giving the example of the 25-year-old with obesity versus the 74-year-old grandma that has diabetes and is on oxygen, a chronic lung disease is another one, obviously. We're going to prioritize the older, sicker patients first. And that's why we're systematically going through that. A lot of myths out there I've heard that La Familia is just vaccinating all of our patients, that you don't have to worry about what category you're in, that you can stand outside of La Familia and get a shot at the end of the day. Please don't do that. We're not giving free shots out at the end of the day, willy-nilly. We do have a waiting list of those high-risk people of our patients that we're calling. So don't hang around La Familia, don't call us up. Only if you are a patient of the La Familia, the way that you can get it is ask your PCP where you are in the line, and we'll put you in the line even if you're not right now in the group. And that's true of anybody in Santa Fe. Talk to your PCP, your primary care provider. You're looking at me like I'm using acronyms again. I caught it this time. Your primary care provider, please call your doctor, your nurse practitioner, your physician assistant, whoever you go to for your healthcare. If they're affiliated with Presbyterian or Christus or La Familia or Presbyterian Medical Services, PMS, the Guidance Center, those are all folks that do have vaccine and are giving it out. The supply over the next couple of weeks especially could get a little dicey. So, and maybe you're not in the group that's right now and they'll put you in a waiting list, or they have their own procedure for that. The most important thing though, no matter who your primary care provider is to get signed up on the Department of Health app. And because the Department of Health is giving more vaccines out in Santa Fe than anybody else is. They're giving 1,000 a day, I think 4 days a week. So they're giving 4,000 shots a day. Christus is giving about 1,000 a week, and then we're giving about 300 a week, just to put that. And I don't know about Prez and the other folks. And then there's this other thing about the pharmacies, all right? The pharmacies are getting doses in and more doses in through this federal arrangement that Biden announced last week, I expect. And they also, though, are going by the app, or should be going by the app with the Department of Health. So, you can try calling the pharmacies, but it's going to be crucial that you're signed up for the app as well.
Yeah.
So those are the ways I know.
Couple things I want to add to that. Number one, I was talking to a friend of mine today who's got a older mom living here in Santa Fe, 90-year-old mom, and they signed up and they didn't hear anything, and she was worried. She called the DOH hotline, got through, got a call, talked to a person. There are people there who can offer help. So the DOH hotline that's on their website, call them up, talk to them. Secondly, I was talking to some folks this last week from the Fiesta Council. I want to give them a big shout out. Not every senior is comfortable with operating a smartphone or a website or sending text messages. Shout out to the Fiesta Council. They offered to be helpful to seniors who are a little bit, may not be tech savvy. Third thing is there is also on the DOH website a place to volunteer if you want to be helpful. I know there are folks who would be willing to do things like help direct traffic or move information forward. People who may be retired nurses or docs and could be in some way assist DOH. They have a DOH assistance volunteer link at the DOH site. Feel free to click on that. It's a good way to be constructive as we try to move the vaccination process forward. The other thing you said on a call we were on Thursday, Dr. Johnson, I thought you used a very interesting metaphor. You said every Monday, when you find out how many doses you're getting, it's like Christmas morning. You go unwrap the package to see how many doses are inside this week. And I think folks need to know that it's not La Familia or Christus or Prez or anybody who says, oh, we only want 1,000 doses. Please don't give us any more. It is an allocation, and you don't know what's coming until it arrives on Christmas morning, Monday morning. You open up your package and there's your dose allocation.
Yeah, absolutely. So we're doing the best we can with, just rolling with the changes. I just brought up the Department of Health website. So it's 1-855-600-3453. And we can maybe put that in the then press 4. If you don't have internet access for when you get the prompts, press 0 for vaccine questions and then press 4 for tech support.
Great.
And then don't press anything else, because that's one other thing that I've heard is people are not negotiating the menu correctly and getting to the wrong place.
And
so, and I've had a lot of people have really good success with that too.
I will also vouch for the fact that having registered at the DOH website a while ago when they first advertised it, I got a text message just the day before yesterday saying, just because you haven't heard from us doesn't mean you're not registered. You are. Here's a reassurance. So they know that there's a lot of concern in the community about whether, if I haven't heard from you, does that mean I'm not really registered? They're doing more feedback loops to keep people in the awareness that, yep, you're registered, and when it's your turn, you'll hear from us. Any last words before we jump off, Dr. Johnson?
I just would say the next couple of weeks might be a little bit of a bottleneck. We're going to sort out, I don't know how many doses the pharmacies are going to get. There's some word on the street that us and Christus could get fewer doses. I'm not sure. But so be patient, call the hotline number, go in and check your registration, Department of Health, get a buddy. If you cannot use the internet, try to find a buddy. And if you know an older person, check in with them and see, or a person that you know has chronic disease, check in with them and see, do you need help? Can I help you do this? Give them a call, because you could put your email down there for another older person. And when they let you know, then you can call them and maybe even give them a ride to the vaccine site. So be a good neighbor. But I do believe that 2-3 weeks from now, we are going to get a more steady supply. Johnson & Johnson is going to come on a new vaccine, AstraZeneca probably right after that. And so I think by March, April, we're going to be in real good position, especially in Santa Fe, where we've already done so well. So
Great.
stay tuned.
Thank you, Dr. Johnson. It's always good to see you. I hear you're getting a haircut.
Yeah, I'm going right now
All
to
right.
do that.
So the next time we see you, you'll be looking a little different.
Yes.
First time you've gone out of the house in a while for a personal appointment. You've been too busy with
yeah.
a lot of
I
health
need to make
care.
my next appointment too. So, and I just got 2 weeks past my second vaccine, so I feel like I can do it. So
Well, we're making progress. Thanks for your good words, and I'll see you in a week. Take care.
All right. Bye.
Thank you. Always good to have our own local Dr. Fauci on the call. I got a few things I need to talk to you about real quick, things that are happening. First of all, if you don't know it, this is Black History Month in the United States of America. It's a very important month for us to recognize Black history and the contributions of African Americans, the history of the African American experience in North America, in the United States. Pay attention, get a book, go to the library, watch a film, check it out. A lot of important history to be told all year long, but this month is particular Black History Month. And we also have coming up the Sweetheart Auction for the Cancer Foundation of New Mexico, February 6th through the 14th. Start bidding tomorrow. It's a annual event. www.cffnm.org. cffnm.org. And it's a great cause. Cancer continues to take far too many of our family and friends in our community, and the Cancer Foundation does an incredible job of helping people who are trying to navigate cancer treatment. Another important piece of news is that there will be food distribution at the Santa Fe Place Mall tomorrow, February 6th, 8 to 10 a.m., courtesy of the Food Depot, who always, Sherry Hooper and her team and volunteers, working so hard to keep everybody fed in Santa Fe County. It's really important. We need to do everything we can to keep people fed, keep people healthy. And we're obviously also working, if you watched on Wednesday, Housing is a huge part of our agenda for community and social health and well-being, trying to get ahead of the curve when it comes to the potential for evictions once we're out of the COVID period. We don't want people to lose their housing then. So a lot of work to be done on food, shelter, health, well-being, all the social indicators of health. We know that in this COVID period, stress goes up. Don't be at all shy about asking for mental and behavioral health assistance right now. There are hotlines to talk to people if you're feeling overwhelmed by all of the things that life is throwing at you. Please ask for some help, get some help, talk to somebody who can give you some help. We all want to make it through COVID safe and sound and healthy. Something else our wonderful librarians are doing is the Santa Fe Library action of felted banners to benefit the Navajo Nation. It's an auction. It begins, well, it's already begun. The last day, it ends Monday, February the 8th. It's an auction of felted banners to benefit the Navajo Nation COVID-19 Relief Fund. You can look it up. It's a long URL, felt during covid-auction.betterworld.org. Felt during COVID is an important part of helping our Navajo neighbors and giving them some assistance, and also recognizing, as always, the great work that the Santa Fe Public Library does, the librarians, the team, to make life better for all of us. That is our webcast for this Friday. We're at the end of another very active week in city government, a lot going on. We are continuing to bend the curve when it comes to COVID. We got to drive those numbers down. Like Dr. Johnson said, we want to go from red to yellow to green, and then from green, keep going, stay healthy, open up, recover, get our businesses going, get our participation with the state ramped up for more business to operate. One quick footnote, there was an article in the paper this last week about an independent salary commission about the mayor's salary. And I've gotten some calls saying, well, gee, why do you think you deserve a raise, Mr. Mayor? And the fact is that commission is not about me at all. Every 4 years by ordinance, there has to be a commission appointed to look at whether or not the mayor, whoever it happens to be, me or somebody else, is warranted to get a raise. I frankly think in COVID period we're in right now, it's very hard to justify the mayor, any mayor, getting a raise. I'm not advocating a raise. I'm not looking for a raise. I'm not asking for a raise, but there is a requirement by ordinance that such this commission get appointed. So we'll appoint it. I suspect they will quickly conclude that the mayor doesn't need a raise and move on. But if you're worried about a raise for the mayor, I would not lose any sleep about it. I don't see that coming my way, or frankly, the next few years, the next mayor. It's not going to happen. Whenever we get to a raise, it'll be down the road, and it'll have to go through this commission 4 or 8 years from now. So no worries on that front. That's about it. It's good to see everybody. Have a safe weekend. If you're a football fan, enjoy the Super Bowl. Enjoy it safely. Don't make it a super spreader event. Please stay in your family bubble. Make sure that everybody is careful. Make sure you're wearing your mask when you go out and washing your hands, using hand sanitizer, practicing good, safe, COVID-safe practices. As we get from red to yellow to green, we'll see more opportunities for our mom and pop businesses to open up and do better. If you have money to spend, please keep your money here in Santa Fe. Shop local. Put your money where your home is, right here in Santa Fe. Support our mom and pop shops. They need your help, your dollars right here in Santa Fe. So till I see you next week, please remember to stay safe, Please remember to take care of yourself and your family. Take care of our community, and all together, we'll do a great job of keeping Santa Fe safe, open, together. I'll see you next week. Take care.